cancer is extremely prevalent in African American men and women, and the outcomes can be challenging. Joining us today is Dr. Ted Teknos, the president and scientific director at University Hospital Seidman Cancer Center. He is also a surgeon specializing in head and neck cancers and will be sharing with us about what we should know to try to help improve these outcomes and ways to prevent head and neck cancers.
The most common risk factors for head and neck cancer are smoking as well as drinking alcohol. So if you smoke, you're 4 times as likely to develop a head and neck cancer than a person who doesn't smoke. And if you drink hard liquor, you are twice as likely to develop a head and neck cancer than someone who doesn't drink. And if you do both, you're 10 times more likely to develop a head and neck cancer. If a person experiences a painful ulcer on their tongue, another thing that, should be a red flag to indicate that something may be wrong is a new bump in your neck. And then the other very important thing is voice change. That is a clear indication to have that area checked out. Our African American patients have higher rates of oral cancer. That's cancers of the tongue, cancers of the gum line. In addition to doing our standard treatments, which may include surgery, radiation therapy, or chemotherapy, what we can do is identify the genes that are driving the cancer. We can now use what are called targeted agents to fight the cancers more effectively based on the genetic makeup of a person's cancer. HPV, which stands for human papillomavirus, in simplest terms is what causes wart. And it's a virus that's communicable through even more casual contact. And when that virus gets into the head and neck area, it increases the likelihood of developing a cancer to an infected individual by 40 times what somebody who's never been exposed to that virus. The great news is there's a vaccine that can protect us against this virus. 50% of women and 80% of men will be exposed to that virus at some point in their lives if they're sexually active. Beginning as early as age 11 and all the way up to age 45, you can prevent malignancies from occurring. Number one takeaway points are, as much as possible, decrease our exposures that cause the cancer. So, try to minimize smoking and drinking. At university hospitals, we have tobacco treatment and counseling programs, which are available to help people quit smoking. The vaccines are critically important. So getting the HPV vaccine is so important. And then just realizing that, early detection is the key. So if you are concerned at all about any of the symptoms we discussed, reach out, and we'll get you in as soon as possible to get things checked out. And more than anything, give you reassurance that things are fine.
Now, we thank Dr. Ted Teknos for being here with us today and sharing this important information with our audience. Talk to your primary care provider about the HPV vaccine and other important immunizations. To learn more about our Black Health 365 program, visit WZAKCleveland.com/BH365.